Namaste. I'm Komal Agarwal, a cardiopulmonary physiotherapy specialist and a senior team leader working at Sakra World Hospital. And today we have Dr. Sreekanth Shetty, the head of cardiology from Sakra World Hospital, and we are here to discuss on the most commonly terminology, that is cardiac rehabilitation. So let us start with understanding what is cardiac rehabilitation. It is a medically supervised program which helps to optimize the risk of cardiovascular events, and it helps people to enhance an active and healthy lifestyle. So in this, we have a multidisciplinary team of specialists who take care of the patients in order to achieve the optimal health status. So what would you like to mention today?
So when the kind of patients that we manage, it broadly ranges all the way across from a very stable patient who comes to the OPD. You can't even call him a patient, he comes for preventive health checkup, let us say, to the other end of the spectrum where people who have major surgeries like cardiac bypasses or valve replacement, and then you also have patients who have refractory heart failure, or people who have been hospitalized with congestive heart failure and need to go home. Now, our aim at all times, whether it is with somebody who comes with no complaints for a preventive health checkup, to the patient at the other end of the spectrum who is having refractory heart failure, our aim with all these patients is to make them live a wholesome life outside of the hospital, wherein they can utilize their functional capacity to the best and improve on their quality of life. Now, this doesn't depend only on merely writing medications. These patients require a lot of hand-holding, and you need to retrain them to do their activities of daily living. That is where the role of a cardiac rehabilitation specialist starts. So, particularly for patients who are discharged with heart failure diagnosis, when they go home, there is something called transition of care.
Yes.
So this is very important. Not only does this help these patients to recuperate back to their baseline health status faster and in a better way, it also helps to prevent rehospitalization. So we need the assistance of our cardiac rehabilitation specialists in assisting our patients to bounce back to their normalcy once they are discharged. So I'm sure you will be talking about what you do on a daily basis. So cardiac rehabilitation also has an important role for managing patients who are admitted in the hospital, whether it's in the ICU or when they are in the wards and all that. So the needs of each patient are different depending upon their functional status during illness, as well as what is their baseline functional status prior to hospitalization, what we call the pre-morbid status. So, and I am glad to say that Sakra is probably one of the only hospitals which has got a very elaborate cardiac, pulmonary and neurological as well as orthopedic rehabilitation, which plays a big role in enhancing the lives of our patients. Thanks to all of you.
Thank you so much, sir, for the wonderful insight. So as sir rightly said, it is a teamwork when it comes to cardiac rehabilitation. There are a multidisciplinary team of specialists which involve cardiologists, cardiac surgeons, physiatrists, cardiopulmonary physiotherapists, occupational therapists, clinical yoga therapists, clinical psychologists, and clinical nutritionists. We all work here as a team in order to achieve the best quality of life for a patient. So there are a lot of studies which reveal that only up to 14 to 31% of the people who suffer from heart attacks or 35% of the people who undergo bypass surgeries enroll for the cardiac rehabilitation program. The benefits of this program is not known to most of us. So let us know what are the short-term and long-term benefits. For example, in the short-term benefits, we see that it helps to control the cardiac symptoms such as chest pain or breathlessness. It also helps to improve the functional capacity and the ability to perform their daily tasks independently. It boosts psychosocial and vocational status of a person. When coming to the long-term benefits, we have noticed that it helps to stabilize and reverse the progression of the disease, and it also reduces the risk of sudden deaths and infarction. So, sir, what would you like to say about preventing or minimizing the risk for a person with a heart condition?
So, like I mentioned in the beginning, even a patient with no disease also can benefit from cardiac rehabilitation, because just like how you have preventive services for cholesterol management or blood pressure management or for sugar management, cardiac rehabilitation can also start as a preventive intervention.
Yes.
Because people would have forgotten exercising all their life, and then when they are in their 30s or 40s, now they want to start a new exercise program. It always helps to have somebody to guide you. When you start a new exercise program and you have some undiagnosed heart disease or uncontrolled blood pressure, it's quite likely that you may run into trouble.
Right.
So part of the evaluation is done by the cardiologist, who will check your lipids and blood pressure and sugar, maybe do your ECG, treadmill test, etc.
Yes.
Taking on from there, your physiotherapist, the cardiac rehabilitation specialist, can assess your functional status as a baseline and guide you as to what are your weak areas, and then how you build onto it, and tailor a specific exercise program which will be most suitable for you.
Right.
So this is on the preventive side. And then for patients who are hospitalized with illnesses, for them obviously you will assess their functional status and whether their heart failure is optimally managed or not, and then according to their clinical status, oxygen, blood pressure, etc., you will give them a tailored program for rehabilitation, which continues from the hospital into your homes, so that you are back on your feet and with an improved functional status. So I will ask you, do you think cardiac rehabilitation is okay for patients who have undergone a heart surgery?
Yes. So it is a very, very safe intervention for patients who undergo cardiac surgeries. It is very important that every individual who undergoes a surgery or a very small procedure also initially starts with the institutionalized program. So it is required that a continuous monitoring and supervision is done in the initial phase. For the continuity of care, in order to maintain the benefits that a person has achieved, we would recommend a home-based program which could be remotely supervised, or the patients could do on their own under the supervision of specialists and regular follow-up and screenings.
So you do have online programs for these patients,
sir,
where you do like a video consultation?
Yes, sir. We do have online consultations, and along with that we also prescribe certain equipments based on the patient's needs and performance, that what all they could do for their personal use in order to build up their respiratory function, their endurance levels, and the overall muscle power and strength.
How important is improving respiratory function in the recovery of patient post-cardiac surgery?
So as we all know, the heart and the lungs, they always work together. So in order to improve, for example, a person who is posted for a surgery also, it's very important for us that pre-operatively we make sure that the lungs are functioning well, they have a good lung capacity, and they do not have any secretion retention in their lungs. So pre-operatively we have to make sure that all of this is clear, and then post-surgery we try to enhance the lung capacity, build up the respiratory muscle strength using various devices like incentive spirometers, inspiratory muscle trainers, in order to bring back a good quality of life for the individual.
So for these patients, how long do you typically do these cardiac rehabilitation exercises?
Yes. So cardiac rehabilitation may range between a period of 2 months to 8 months. Initially, when a patient comes to us, we do a detailed screening program in order to understand their blood pressures, their functional capacity, their ability to perform daily activities. We also see if patients have been into a habit of tobacco consumption, and emotional well-being of a person is very, very important. So seeing all these parameters, we design an individualized program for the patient, and we periodically do screenings and assessments to understand the progression in the patient. So based on the progression, we decide whether they need to continue as an institutionalized program or switch over to the next phase of the cardiac rehabilitation.
So one question a lot of people may have on their mind is, if you are on cardiac medications, is it okay to undergo cardiac rehabilitation or not? So So it is okay even if you are on medications like heart failure medications or blood pressure medications or blood thinners or antiarrhythmic drugs. It is okay to undergo a cardiac rehabilitation program even though you are on this medication. In fact, patients who are on these medicines need a hand-holding process more than somebody who's not on medications. So going through a supervised program is safer, and also because your cardiac rehabilitation specialist is going to give you a structured program with targets, it will make the full process objective. You will also know how you are progressing and how you are improving. While a patient guided program can also happen. I mean, like sometimes I tell those who cannot avail of a cardiac rehabilitation program, what we tell them is, for example, you walk as much as you are comfortably able to do, and then you gradually start building on it. But what happens is your vital parameters and all are not monitored in that situation. So the patient may push himself or herself to a point where he may develop a low blood pressure or trigger an arrhythmia or trigger an ischemic event, which might put the patient at risk. Whereas in a monitored cardiac rehabilitation program, because all these vital parameters are being checked on a regular basis, the whole process becomes objective and safer. So one more thing that I would like to ask is, how do you measure as to whether a patient is improving or not improving when you are putting them through this cardiac rehabilitation program?
So what we do is periodically we consider all the globally approved outcome measures like measurements of functional capacity, blood pressure monitorings, emotional well-being with the help of outcome measures like the 6-minute walk test. There is something called a PHQ-9 physical health questionnaire wherein the patient shares their perceived level of emotional well-being, and this is how we are able to monitor whether the patient is improving with the help of this program.
Yeah, like you pointed out, assessment of emotional well-being of a patient is also a very important component of measuring whether a patient is benefiting from the therapy or not. It's not just about physical well-being, it is about holistic improvement, not just improvement in your blood pressure, cholesterol, sugar or other parameters, but a holistic improvement in your physical and mental well-being. So that is what this cardiac rehabilitation program aims to achieve, and that is what makes it so unique and so useful. So you are also mentioning that you do online sessions. So
yes.
Do patients show a lot of interest in these online sessions, and do they find it useful, beneficial?
So what challenges I would like to share, like what challenges we face is sometimes the communication in the online sessions are a problem for few of our patients. Also, there could be limitations like the patient outcomes may vary.
Yes.
So when they come to the institution and they do under our supervision, one-to-one care can be provided and continuous monitoring can be done. Based on that, we can always modify the protocol that we have designed for the patient. But in case of remotely supervised programs, these things cannot be taken care of. Also, there is a lack of equipments that are required for evaluation and training. So we can definitely help a patient. We have seen improvements in our patient through online sessions, especially during the COVID-19 pandemic. It was not possible to ask our patients to come to the hospital to reduce the risk of infection. But it is always better if they can visit us on a regular basis for proper screening and understand what next is required to be done in order to achieve the optimal health status.
So for patients who have undergone heart surgery,
yes, sir.
When does your rehabilitation process start? Is it as early as post-operative day 1?
Yes, sir. So as you rightly said, cardiac rehabilitation is divided into different phases. We have phase 1, 2 and 3. So in the first phase, as soon as the patient has undergone a heart surgery and all the parameters are stable, we can immediately start with the cardiac rehabilitation in the inpatient setting. Gradually, after discharge, we keep monitoring the patient and enroll them for an OPD-based program. And then further for maintenance program, we switch to the other transitions of care.
So for these patients who are discharged, do you think it is safe to do a home-based program? And do they need to buy any equipment to do this? Do you provide any specific prescriptions for equipment to be purchased at home?
Yes, sir. So as you said, after discharge, immediately we do not prescribe anybody to undergo a home-based rehabilitation program. We would always like them to have supervised training sessions. But based on their requirements, we do prescribe equipments like respirometers, some kind of endurance training tools, TheraBand, which is resistance bands for the strength. So based on their level of requirement and their recovery, we decide what all can be added.
So you heard from Komal as to what all they do and what are the potential benefits for patients post-cardiac surgery or patients who are admitted with severe cardiac illnesses in the hospital, and when they are in the hospital, when they are discharged to home, how they do this rehabilitation process and how it helps patients bounce back. So I can tell you that when a patient is in the hospital also, the longer they stay in the bed without movement, the more they are at risk of developing complications like deep vein thrombosis, urinary infections, respiratory infections, and bed sores, which extend their hospital stay, increase their morbidity and risk of mortality, risk of aspiration, and also if you extend the same to out of hospital, even when they are at home, if the mobility is limited, then gradually they lose muscle strength, they develop osteoporosis, and all the complications that I spoke about which they could develop in the hospital when they are in the bed, the same things could also happen when they are at home. So the overall potential for recovery is lower in a patient who is immobile, and then the quality of life that you can hope to achieve will also be much inferior. The risk of rehospitalization for different problems also increases. So cardiac rehabilitation is an inherent part of treating patients with cardiac ailments, the entire spectrum of cardiovascular diseases. Like I said, it spans from preventive cardiology to the management of patients with refractory heart failure, and I'm glad we have an excellent team in Sakra who are delivering this kind of rehabilitation to our patients, and partnering with them helps us to give great care to our patients. Thank you so much.
Thank you so much, sir. Thank you for